Decoded.
Welcome to Book Decoded. We're the podcast that, well, decodes the big ideas from important books.
Helping you cut through the noise.
Exactly. And today we're tackling a really interesting one. Patient No Longer. How you can lead the consumer revolution in healthcare. It's the second edition by Ryan Donohue and Klasko. Our goal here is pretty simple. Figure out how healthcare is changing, really changing, and what that means for, well, for you.
Yeah, and it's a critical topic because, as the book lays out, healthcare has just been, well, kind of a mess for a long time, hasn't it?
Fragmented, definitely expensive.
Oh, incredibly expensive. Like back in 2019, it was eating up something like 17% of the entire U.S. GDP. Just staggering.
Wow.
And the book's main point is that this old system where patients were sort of passive, it just wasn't working. It's shifting now, driven by consumers, by you demanding something better.
And it connects back to earlier ideas too, right? I mean, this isn't totally out of the blue. The book mentions Harvey and Jean Picker.
Yes, absolutely. Pioneers, really. Back in the 80s, they were already talking about patient-centered care.
What did that involve?
They outlined 8 key areas, things like respect for patient values, coordinating care properly, emotional support. Stuff that sounds obvious, maybe, but often wasn't happening.
And NRC Health did research confirming this stuff still matters.
Huge research, over 8,000 patient interviews. And yeah, the same themes pop up. People want better access. They really want that emotional support.
And I often wish they'd, spoken up more for themselves.
Exactly. That feeling of, I should have pushed harder, or I wish I'd asked more questions. It shows the system wasn't really empowering them.
So what's driving the change now? Is it just frustration?
Frustration is part of it, sure, but a huge driver is cost.
Yeah.
Real out-of-pocket costs for people.
The high deductible plans.
You got it. They cover, what, a third of workers now? So suddenly you are paying a lot more upfront before insurance even kicks in.
Right. That makes you a much more demanding customer.
Precisely. You want value, you want transparency, you want convenience, and that's fueling this massive acceleration in tech adoption.
Like telehealth.
Telehealth went nuts, expanded like 20-fold almost overnight. And patient portals, remote monitoring. These aren't just neat ideas, they're cutting costs, sometimes over 30%.
So it's that healthcare at any address concept the book talks about.
Yeah, healthcare coming to you on your terms, wherever you are. It's a fundamental shift.
But it's easy to just focus on the apps and the gadgets, isn't it? The book seems to say the tech is only part of the story.
Oh, completely. It hammers home this idea of human understanding.
What does that mean exactly?
Well, look at the NRC Health data again. Something like 63% of people say being treated as a unique person is super important.
Okay, makes sense.
But only 38% feel like they actually get that experience. There's a huge gap there.
Wow, yeah.
And here's a fascinating link they make. Employee engagement. How the staff, the caregivers feel.
How does that connect?
It connects directly. When caregivers feel understood, when they feel valued by their organization, guess what? Patient experience scores go up significantly.
So happy doctors and nurses mean better care for you.
It's not just about bedside manner. It's about the whole system supporting the people providing the care so they can better support you. It's a two-way street.
That's a really powerful insight. Often overlooked, I bet.
Definitely. And the authors then talk about non-disruptive creation.
Yeah, what's that? Sounds less scary than disruption.
Kind of. Instead of just tearing down the old system, it's about building new, better ways alongside it. Shifting focus.
Shifting from what to what?
From just treating sickness, sick care, to actively promoting wellness, what they call health assurance.
Right, prevention, keeping people healthy in the first place.
Exactly. Using innovation, using AI, maybe AI nurses for routine stuff to free up humans using integrated care models. It's about focusing on wellness before you even get sick.
And leaders need to change too, become chief consumer officers.
That's the vision. Leaders whose main job is understanding you, the consumer. Making sure the entire system is built around your needs, your values, meeting you where you are, empowering you.
So, bringing it all together, this whole revolution in healthcare, it's happening fast. What's the bottom line for someone listening for your health journey?
I think the core question the book leaves you with is this. In this changing landscape, how do you actively make sure your values, your well-being, are genuinely driving the care you receive? It's about becoming that empowered consumer.
A really important question to ponder. Until next time, stay well and keep decoding the world around you.